The broadcast is now starting. All attendees are in listen-only mode.
Hi there, and welcome to the first in a series of webinars for small businesses about the Affordable Care Act and what the healthcare law means for your small business. We want to thank all of you for attending, and for those of you who have not done so so far, please insert your audio pin, pound, and then the audio pin that you can find right beneath your access code. And once you insert that, then I will be able to mute and unmute you during the question and answer session. I also wanted to point out that the session is being recorded. We will be recording the webinar in its entirety, including the question and answer session, and then we will post it on IllinoisHealthMatters.org on the small business page. So if there are any sections of this webinar that you would like to review, you can go back and listen to it in the future. So welcome. Just one quick order of business. I wanted to talk a little bit about the Enroll Chicago Small Business Initiative. We are a collaborative between the Health and Disability Advocates, which is the home of Illinois Health Matters, and our partners at the Campaign for Better Healthcare and their Small Business Healthcare Consortium, and our national partners, the Small Business Majority. Thank you very much for attending, and we look forward to hearing your questions. So at this point, I'm going to turn it over to my colleague, Michelle Thornton, who works with HDA on the Small Business Initiative.
Thanks, Barb. I am happy to help kind of guide through today's material. We will have three presenters joining us today. Myself, Mary Timmel from the Small Business Majority, and Jim Duffett from the Campaign for Better Healthcare. And we will get started today with Mary Timmel, who will begin by telling us a little bit about the Small Business Majority.
Thank you so much, Michelle, and hi, everyone. Thanks for taking the time out to join us today to discuss this topic. I am Mary Timmel. I'm with the Small Business Majority. We're a nonprofit small business advocacy organization. We're founded and still run by small business owners, and we're focused on outreach to and education of small business owners across the country. So we're a national organization with offices in Washington, D.C., Virginia, Ohio, Colorado, Oregon, Missouri, New York, California, and Washington State. We focus on research of what small business owners feel on the issues of top importance. We define small business as less than 100 employees and include the self-employed in that conversation. Beyond healthcare, we also work around taxes, access to capital, clean energy, and more. But today we're here to talk about healthcare. Let's talk a little bit about why the Healthcare and Affordable Care Act were so important to small businesses. We at Small Business Majority know how small the margins small businesses operate under every month. And the soaring cost of insurance, especially for small business owners, has left 25% of small business owners with fewer than 25 employees uninsured. It's also left about 28% of the self-employed not covered, and with small firms paying about 18% more than large businesses. And much of this is simple economies of scale. Right now, the small group marketplace is not big enough to compete with large businesses and the sheer number of their employees. Next slide. Our most recent opinion survey says that small employers who don't offer coverage say that lack of affordability is the biggest reason for that at 70%. Another recent Small Business Majority poll has shown that 72% of those who do offer coverage say they are struggling to do so. And we start with this information not because it's a surprise to small business owners, but to really talk about why the Affordable Care Act provides such opportunities. Next slide, please. So a little bit about the Affordable Care Act, the ACA. It builds on our existing healthcare system. It aims to rein in healthcare costs. It was upheld by the Supreme Court back in 2012, and the implementation is primarily the responsibility of the state. Next slide. So the Affordable Care Act, why it matters to you. Most Americans will be required to have health insurance. And there are opportunities for employers to provide insurance to their employees, really addressing the needs of those small businesses with fewer than 50 full-time equivalent employees, with special tax incentives for the smallest of the small businesses. And whether you choose to provide insurance or not, small business owners are getting questions. Owners and managers will be asked by their employees, and folks are really wondering what to do and where to go. So you're an excellent source of information for the employees and for the folks that you interact with every day. So there are some immediate consumer protections, moving forward into the next slide, that do affect small businesses. Insurers will no longer be able to deny coverage for patients with pre-existing conditions. I've been doing these presentations for a while now, and I'm so excited that we're at the 2014 that this ban on pre-existing conditions is in place for adults as well as children. It went into effect for children back in 2010. So moving into this year, it's no longer a barrier for adults to get insurance. The ban on lifetime caps that set limits on coverage has been phased out. That was a $750,000 cap beginning in 2011. Now, starting January 1st, 2014, there is no lifetime cap limit anymore. Adult children under the age of 26 can stay on their parents' plan. This actually went into effect in 2010, and it allows parents to keep their children on their insurance as they're transitioning out of school, looking for work, really working at a job that doesn't provide coverage. It allows parents to give that opportunity to their children. And moving into the next slide, a few more consumer protections. Health plans can't drop coverage when a person gets sick or if there is an unintentional mistake on their paperwork by either the employee or the employer. Some really exciting portions of the Affordable Care Act that impact small businesses and weren't directly targeted to them are first dollar coverage for preventative care for all new plans. So currently, 54 million Americans with private insurance now have preventative service with no cost sharing or copay. So this is really looking to help maintain the health of small business owners and their employees rather than just addressing issues when they get sick. So for you and your employees, this would mean blood, diabetes, cholesterol tests, many cancer screenings, counseling and screenings, vaccines to ensure healthy pregnancies. For you and your family, this could be well baby and child visits, routine vaccinations against diseases such as measles, polio, and meningitis. And then there's also increased access to care through community health centers. So there's 1,200 health centers that operate nearly 9,000 service delivery sites across the country, and they've received increased funding to expand and to provide more than 21 million patients nationwide with, again, increased access to that basic health care. So maintaining the health of folks rather than just waiting until something happens. So really looking at that. Moving forward to the next slide, what now for individuals and self-employed? What do you need to be looking at? So right now, individuals can purchase coverage for themselves, their families, their dependents on your state marketplaces, and all of these plans have the same set of essential health benefits. So this is another exciting portion of the Affordable Care Act. There's a comprehensive package of items and services in 10 categories. So ambulatory and patient emergency services, maternity and newborn care, mental health services and behavioral health treatment, prescription drugs, preventative and wellness services are just a few of the ones that are covered. So no longer will you have to piece through each plan to make sure it has those specifics that you need or that you may not know that you need, but in the future they come around and that's something you don't need to look for anymore. Those are all included. And the plans on the marketplaces are organized by title level. The quick, easy way to describe that is there's various levels, premiums, and out-of-pocket costs. So the bronze level plans are the ones with the lower premium monthly payment and a higher out-of-pocket cost in general, and the platinum plans have the highest premiums, lower out-of-pocket costs. So when you go on the marketplace, you're able to look and really assess those plans by what you can afford month to month, what you think your out-of-pocket costs will be, and then assess the networks of those plans as well. One of the other exciting features of the Affordable Care Act, we'll take a look on this next slide here, is how it helps to keep costs low. So most folks, most people are eligible for some financial assistance on a monthly basis if they purchase through the individual marketplace. Now, financial assistance is provided on a sliding scale, and it's available to individuals and families with household incomes between 100 and 400% of the federal poverty level. Some low-income families can also be eligible for cost-sharing reductions. That's for families between roughly 100 and 250% of the federal poverty level for that. And what's really exciting is the marketplace will actually calculate your eligibility for you and manage those premium adjustments. So as you work through your enrollment in the marketplace, either with a certified application counselor, a navigator, or yourself on the website, when you're putting your information in, that marketplace will calculate it and let you know where you stand. So individuals and families simply pay one monthly premium directly to the marketplace. And the federal or state health insurance marketplace in each state is also going to calculate eligibility for advanced premium tax credits, Medicaid, Medicare, or S-CHIP during the application process. So it's really a no wrong door process for people working to enroll. And another way, here's a quick example of how it's helping to keep costs low. So if you have a family of 4 with 2 45-year-old adults, 2 children under 20, and an $80,000 annual household income, that unsubsidized insurance premium with the silver plan through the individual marketplace. So if you remember, we discussed that plans are organized on metal level, with the bronze plan being the lowest premiums and the highest out-of-pocket costs. Silver's right in the middle there, and then platinum being the highest premium, the lowest out-of-pocket cost. So these are all calculated with the silver plan through the individual marketplace. You're looking at the unsubsidized insurance premium being $12,549 a year. This is just an example from the Kaiser Family Foundation. But because they're at 340% of the federal poverty level, they are eligible for premium assistance, about almost $5,000 per year credit. So their total out-of-pocket cost for that plan would be $7,600 for 2014, or $633 a month. So it really helps break it down exactly what the cost can be and how the marketplace is helping families afford insurance. And there's one more slide here for me. We'll talk a little bit in the next slide about individual shared responsibility requirements. What this does is if there are people out there who cannot afford insurance or they can afford insurance, and they don't have coverage beginning in 2014, they may have to pay a fee. So starting in 2014, that fee for not having coverage, if you are deemed able to afford it, is 1% of your yearly income or $95 a year, whichever is higher. And that increases to 2.5% of your income or $695 per person, whichever is higher. So it'll be paid on your 2014 income tax forms, which are filed in 2015. Now, one of the things we want to make sure is that folks who are, this is a individual responsibility for people who are deemed able to afford insurance. So there are waivers for people who are low-income individuals who aren't filing tax returns, people who are uninsured for less than 3 months of a year because they've somehow fallen through a gap for those 3 months. If you lived in a state that did not expand Medicaid and you would qualify, you are eligible for a waiver as well. I understand Illinois has expanded its Medicaid, so this isn't, that's not quite applicable to you. And then folks in federally recognized Native American tribes and a few others. So, you know, really looking at the individual shared responsibility is for people who are deemed able to afford insurance but have chosen not to get it. And I'm going to hand it over to Michelle to tackle some of the rest of these issues, and I look forward to answering your questions.
Thank you so much, Mary. I appreciate all of the good information. What I'm going to kind of spend the next handful of minutes here talking about is what specifically the ACA brings to the table for small businesses. I think it's important to recognize that the marketplace can not only kind of help fuel competition for health insurance plans, but also provide the eligibility for tax credits to many small businesses to help offset their costs if they are choosing to provide coverage for their employees in addition to themselves. So this, combined with the fact that pre-existing conditions can no longer be discriminated against, really eliminates the idea or the concept of job lock. That is, people that are kind of sticking in employment situations just specifically due to the group health insurance coverage benefits that you would get through a large employer. This really gives entrepreneurs new tools and helps eliminate roadblocks to starting new business opportunities. So the kind of partnership to the individual marketplace that Mary has been talking about is the SHOP insurance marketplace, which SHOP stands for the Small Business Health Options Program. And the best way to think about it is sort of a virtual marketplace for employers to shop for and compare pricing on private health insurance plans. For 2014 in Illinois, small businesses that have fewer than 50 workers are eligible to use and participate in the shop marketplace. Although the open enrollment period for the individual marketplace is coming to a close soon here on March 31st, employers have the ability to continue enrolling small groups throughout the year. The good news is that many brokers have been certified and are able to assist small businesses through the process of choosing a plan, assisting your employees, and helping business owners to stay compliant with relevant regulations. We will go through some of the tools available in Illinois to help individuals and businesses locate help for this assistance shortly here in our webinar. Many people compare the marketplace to something like a Travelocity or Expedia website. It's kind of a clearinghouse, a virtual place where you go to compare and easily look at plans and pricing. The plans are organized by category, which are grouped by the percentage of costs that are covered by the plan. The names that they're given are bronze, silver, gold, and platinum, and those each relate to a specific percentage of costs that are covered by the plan, 60, 70, 80, or 90%. One of the other features of the marketplace, which we'll see enhanced in 2015, is a streamlined billing process, basically allowing employers to have one invoice for all the plans that were purchased in the shop marketplace, even if the employees choose to use multiple insurance carriers. Again, this particular feature is not available in 2014, but really in 2015 when we see that come online, it's definitely where we'll start to see the benefit of the streamlined billing process. So I mentioned early on that there is an additional type of tax credit available for small businesses. And this is really a valuable component of the ACA to help reduce the cost burden of providing employees with health insurance. It did take effect already in 2010, and employers that did not take advantage of it but were eligible are able to retroactively apply for the credit back to that tax year. There are three important criteria that determine eligibility. First, businesses must have fewer than 25 full-time employees. Second, the average annual wages must be less than $50,000. And third, the employer must pay at least 50% of the premium cost. The tax credits are applied on a sliding scale. For tax years 2010 to 2013, it's up to a 35% offset. And then beginning in 2014, we're looking at a 50%. It's important to note, though, that starting in 2014, to continue receiving this tax credit, businesses must offer a plan through the shop marketplace. This is, I think, another important kind of report based off of a study that the Small Business Majority conducted with Families USA to really look at tax credit eligibility and their impact. At this point, we saw more than 3.2 million small businesses that would be eligible for this tax credit. In terms of understanding how to access the tax credit, small employers must begin with the IRS. The Form 8941 is available on their website at www.irs.gov. Many brokers that have been certified are able to assist with this, but we also are encouraging small employers to work through their tax advisors or accountants to assist them with this process as well. Once you've qualified for the tax credit, it will really kind of reflect and determine the amount of tax payments that are available to be applied towards the premium that you are purchasing. One important component of the ACA that I think was somewhat misunderstood and in times overlooked as a requirement of small employers under the ACA is the requirement to notify employees of the existence of the new marketplaces. It's not all employers that are required to do this. They must be the FLSA, or the Fair Labor Standards Act, must apply to the employer. In terms of kind of accessing the credit or the information about the exchange that must go out, employers can find these notifications on the Department of Labor website. Existing employees must have been notified by October 1st, and then on an ongoing basis, employees should receive this when they are hired. I encourage employers, if they did not comply with this notification piece in the fall, that they go ahead and take the opportunity to still do that after the fact. Many times I get asked the question about if all employers are required to offer health insurance. And I think that this is definitely an area that is widely misunderstood. The employer shared responsibility requirement only applies to large employers beginning in 2015. So this is employers that have 50 or more employees. Those that have fewer than that, fewer than 50 full-time workers, are exempt from any requirement to offer insurance. So this is just an important point of clarification. We talked about the fact that there is an individual responsibility to carry insurance. So every individual is required. However, small businesses are not required to provide those employees with insurance. I think that we have to kind of think about the small business market as, in terms of the ACA, as there are new resources and tools to help small businesses provide insurance if they would like to, but none of the small businesses with fewer than 50 full-time workers are required to. One thing that has created some level of confusion is determining exactly how to count the number of employees. Because, you know, if you are kind of hovering around that employee mark, there is could definitely be some concern about whether or not you are required to provide coverage. So the number is calculated through a handful of different components. First of all, again, it must be at least 50 full-time employees or a combination of full-time and part-time employees that work out to be an equivalent to 50 full-time employees. The definition of full-time employees is at least 30 hours per week, and the definition of part-time employees is at least 15 hours a week. One question that's often tried to clarify under this circumstance is that it is what constitutes a seasonal employee, and that would be an employee that works less than 120 days per year. If we are curious about what happens in terms of if an employer that is above the 50 employee threshold does not offer coverage, there are penalties. But I think that one thing I do want to clarify is that there has been sort of some recent delays put on kind of the number of employees as well. And I guess we probably should have included a slide on that, that while the large employer responsibility goes into effect in 2015, that number of employees has been extended to 100 employees until the year 2016. So just to clarify that again, for 2015, it's employers with 100 or more employees that are subject to the employer shared responsibility requirement and the penalties. 2016, that will go down then to the 50 that we're talking about. So here in Illinois, I think it's important to understand that you may have seen kind of lots of PR, media, definitely television commercials, radio spots about Get Covered Illinois. And Get Covered Illinois is really the face of the ACA and the marketplace in Illinois, and really where you can access both the individual marketplace as well as the shop marketplace. So I know that there is definitely some confusion. Do I go to healthcare.gov? Do I go to Get Covered Illinois? What's the best kind of approach? In Illinois, Get Covered Illinois is always a good starting point, and that's basically the easy place to understand which kind of pathway you should fall under. There is an initial tool there that asks several questions that can kind of help individuals as well as employers figure out if they are Medicaid or Marketplace eligible, or give employers information about the SHOP Marketplace as well. On Get Covered Illinois, if you were to go and look through the SHOP Marketplace or try and determine general pricing information, at that point in time, you would be forwarded directly to the healthcare.gov website, and you would find that there are a number of carriers on the individual marketplace side, 7 to be exact, that offer upwards of 100 different plans depending on which county you live in. Through the SHOP Marketplace, there are 2 carriers that are participating. That is Blue Cross Blue Shield of Illinois and Land of Lincoln, which is a co-op. The other thing that you're able to do on Get Covered Illinois is to find strategic partners to help you both understand the options available to you and to enroll in coverage. You have the ability to find either a navigator or an agent or broker to assist you with the process. And you can search that by zip code and be assured that the people that you find have been trained and are certified and able to offer good, available information to help you and your employees make decisions. So as I mentioned, we are coming up close to the end of the individual open enrollment period. If you're just looking for coverage for yourself as a sole proprietor, for example, or you're not looking to provide a group health benefit plan, March 31st, just right around the corner, is the end of open enrollment. Individuals will not have the opportunity to begin enrolling again until October 1st of 2014, with coverage not starting until January of 2015. Small employers do have the ongoing ability to enroll as a group throughout the end of the year. That does not end in a week from now. We're going to go through a handful of different resources for you to be aware of. You heard earlier on the call from Mary Timmel from Small Business Majority. This is her contact information, as well as Emma Hollister from Small Business Majority as well. And what you can find that is sort of powered by the Small Business Majority is the healthcoverageguide.org. This is just good objective information for small businesses throughout the United States. It includes calculators as well as kind of step-by-step kind of suggestions, checklists, ideas on how to navigate all of the choices available to you. Of course, the healthcare.gov website has good information, and this is, as I mentioned, where you can find kind of some preliminary pricing information for you and your employees if you're looking at the SHOP Marketplace. And then here for very specific Illinois information, IllinoisHealthMatters.org, where you can find kind of timely, relevant, unbiased information, as well as some case studies and some kind of easy tools to help you understand what your specific options are here in Illinois. I'd like to go ahead and turn this over then to Jim Duffett from the Campaign for Better Healthcare, who'll talk about one last resource available for small businesses here in Illinois.
Thank you, Michelle, and thank you for all the small businesses for taking some precious time today to go through this. My name is Jim Duffett, and I'm the Executive Director of the Campaign for Better Healthcare, which is Illinois' largest and most diverse coalition representing over 300 very broad-based groups, small businesses, providers, the faith community, labor, health professionals, a very wide cross-section of folks who support affordable, accessible, guaranteed health care. We were founded back in 1989, and back in about 4 years ago, because of the growing interest of small businesses that were contacting our organization, we formed what we're calling is the Small Business Healthcare Consortium, which does have an advisory committee of 11 small businesses and associations, and over 500 small businesses that are involved with us. We all know that no healthcare reform or any reform is perfect, and that changes to the existing law and new laws are going to be needed. And in this slide shows some of the activities that we do, a lot of public education. We do have people who actually can enroll folks. A major goal for us is to make sure that small businesses have a very strong collective voice in Springfield. As the implementation of the Affordable Care Act moves forward, again, we need to have the voice of small businesses, and we do promote working to enact reforms that definitely contain provisions that are friendly to small businesses. Next slide. A philosophy that we actually started back as soon as the ACA was passed, and we know this is going to be ongoing, is what we call the 3 I's. Inform, precisely what we're doing today. Implement, that we are actively involved in implementing the Affordable Care Act here in Illinois, and we have set up and are participating in numerous listening tools to figure out what are the things that need to be changed and to improve. And that's a key component, that we know that, again, no piece of legislation is perfect, and changes do need to happen. Next slide. Some of those changes and things that still need to happen in Illinois that we are working on are two big things. One is Illinois can develop what's called a state-based exchange. Right now, we are part of the federal government's exchange system, but we believe that as 15 other states have initiated our state-based marketplace, that really provides much more oversight that the state can have and more decision-making, that we can make changes quicker. Some of the changes that need to be made to the federal exchange will need congressional action. And I think we all know that the gridlock that is in Washington, and sadly, we don't see that gridlock changing for the rest of this decade. So we believe that we do have that opportunity to move forward and really make our state-based exchange very effective for everyone. Another major component that we have been working on is rate review. Currently in Illinois, if I'm an insurance company, I can set my rates whatever I want to set. There's no check and balance whatsoever. And also in Illinois, we have what's called the Illinois Commerce Commission. And that is a public body that is set up. So when the utility industry wants to raise the rates, at least there's a public process. It's a process that individuals can testify. It's an ability to gather more information from the utilities to justify, do they need a rate increase or not. Here in Illinois, there's no checks and balances at all. And these are two major components that we believe not only will have a positive impact for small businesses, but for the state overall. Next slide, please. In terms of the state marketplace, and this is something that is being debated right now, and we do have legislation that we have put forward along with our business entity, is that there needs to be a governing board that must include small businesses. This cannot just be healthcare experts, but we also need experts from the small business sector to be able to provide input on what works and what doesn't work. We also know that there needs to be cost containment and fairness in the prices. I think prior to the prices on the marketplace that came out, there was what we talked about over the months and years. There was a fear of rate shock, and we have found out that the rates that are on the marketplace are at least 20 to 30% lower than what was being verbalized. But we still know that there needs to be checks and balances. And again, I mentioned rate review and price negotiation with insurers. And there needs to be ongoing stability and financing for not only individuals but for small businesses, so we all can kind of plot out what it looks like for the next several years. And our last slide is just a variety of things that the campaign does do. And there are some surveys that are on here that we definitely are asking people to select. If you do offer health insurance to your employees, and I believe there may be a couple additional slides. But one of the things that our Small Business Healthcare Consortium does do is, as I mentioned, we can help with enrollment, do face-to-face presentations. We're developing policy in collaboration with many groups. And the other key thing is sharing your story. I think it's really important that on all type of issues, and in this case, the Affordable Care Act, that people share their stories, and those stories can really put a face on how things are progressing with small businesses getting signed up. And talking to the media. It's important that the media, and we get calls from the media weekly who do want to talk to small businesses about the impact that the Affordable Care Act has had. And we also meet with elected officials. And there's a couple staff that work on this project, both in Chicago and in downstate. So thank you for your time, and happy to answer questions, and I'll turn this back to Michelle.
Thank you, Jim. I think that we want to go ahead and give you guys the opportunity to ask some questions. Barb, I believe that you're going to facilitate that, and I think that you've conducted an online poll that you can, if you have any questions or anything that you want to go ahead and share with the group or provide for the panelists to answer.
Great. We do have one question, and one question that was sent to me right away is, can nonprofits participate in the shop, and are they eligible for any of these benefits?
And as a not-for-profit, absolutely. And I know the Campaign for Better Healthcare, we have been, and we have a tax credit of 25%. And we still pay our taxes that we have to pay on employees, but at the end of the year, we do receive a check, and I think the last check we received was for $1,700.
Great. If you have another question, you can raise your hand on the attendee side. We've had several questions about sharing the slide deck and posting the recording, and we will be definitely doing that at IllinoisHealthMatters.org. Great. We did manage some polls during the discussion. And it's interesting, 50% of you have explored offering health insurance, while 50% have not. And the majority of you have said that you have less than 5 or 5 to 10 employees. Here's another question that for the panel. What is the best resource to send people if they have Medicare without supplements and are still working?
I can tackle that one. So, so if someone has Medicare and they are still working, and let's assume for at least starters that the employer that they are working for does not have any type of group health insurance plan. If they are looking to purchase a Medicare supplement to go along with that, the marketplace is not going to be the option for them. There are not Medicare supplement plans provided on the marketplace. So I would recommend using either a SHIP counselor, which can be found online, or a Medicare certified broker as well, in terms of finding unbiased information for that. If someone has been covered under Medicare for a period of time, though, they would need to wait until the open enrollment period for that as well to be able to purchase those supplements, which does not commence until the fall. If they are newly eligible, they can sign up for the supplements as they become eligible.
Great. And I will post something in the chat section about where to find a SHIP counselor. We have another question related to immigrants. Can you clarify the eligibility of immigrants to the ACA, specifically for immigrants that are in the process of a green card application? Okay. Do people want me to take that one? We would be happy to post more information about immigrants and the ACA, and I see who asked that question, and it actually does depend upon the status of those immigrants, and it can get very complicated. So I would like to get back to you and make sure that we send you the information that is specific to your situation, and we'll also make sure we have that posted in the question and answer section of the Illinois Health Matters Small Business section.
And Barb,
Another question. Yep, go ahead.
I would also refer people to the Illinois Coalition of Immigrant Refugee Rights. They handle the whole wide variations of people in so many different circumstances. So they are definitely a strong partner in this effort.
And I will put that information up also in the chat section so you can see a phone number and a link to their website. I also wanted to point out on Covered Illinois, you can click on a section that says Get Help, and there you will be able to find a list of organizations and their different competencies. You can see who speaks another language. You can find out who might specialize in working with non-citizens and immigrants. You can also find a list of brokers that might be in your specific area. Okay, we have another question here. This is someone who is working with a law firm, retiree group, that is trying to decide whether they should offer benefits from Blue Cross Blue Shield versus Land of Lincoln. As a navigator, this individual is a navigator, I cannot make specific recommendations. I did try to refer to a broker, but they are seeking additional resources. Anyone want to tackle that one?
No,
Sure.
Go ahead, Michelle.
Yeah, I can comment on that for sure. So, the process of deciding between insurance companies and plans is definitely something that deserves some thought and consideration. What I usually recommend with the clients that I work with, and I suppose I should mention that I am a broker, is to begin, I think that you get some good information to start with on the marketplace about comparing the plan components. But one of the, I think, big differentiators when we are considering and thinking about carriers is network. The doctors and hospitals that individuals and employers are able to use the benefits at. So that's one of my initial starting points that I always begin with, is making sure that the places that individuals and their employees would like to use the coverage are covered in network. I think that that's the first point. I think that there are a number of other kind of components. One additional kind of important decision that's related to network would be prescription drug formulary lists. All of these things are available through either Blue Cross's or Land of Lincoln's website, but those would be kind of at least two good starting points to help differentiate between some of the behind-the-scenes differences between Blue Cross and Land of Lincoln. I think beyond that, obviously there are things to think about just in terms of premium, what the rates look like over time. Blue Cross Blue Shield is a mutual company and Land of Lincoln is a co-op. So those are two different setups in terms of how they are organized. And although we don't have a whole lot of experience to be able to look back or look forward and compare how they will fare in terms of renewal rates, on an ongoing basis, that's something that I think that will start to make a difference for the next year's renewal, and something that employers will have to decide moving forward. Jim, go ahead and add to that, though, if you had something else you wanted to.
Yeah, and Barb, maybe you can put this on also, is that there's another great resource that we've been using in the last 3 weeks. It's called healthplanratings.org. And it really provides the individual with a lot of choices that you can see what hospitals, what physicians are in what healthcare plans. And you can also look at several categories about quality of care. Do you really want a network that gives you more choices, or are you fine with a smaller network of providers? And there is a range of indicators that you can say, yes, I want a larger network, yes, I want a smaller network, and then that will also determine what plans are available for you. So there are definitely a lot of consumer flexibility in the different plans that businesses and individuals can choose from.
Okay, do we have any other questions? If you look on the right-hand side of your screen under chat, we tried to list all of the resources that we just discussed, including the websites from the organizations that participated today. We'll take one more minute just to ask any questions. Here's another question regarding nonprofits. Where does a nonprofit organization start? Do we offer plans to our people that we then subsidize? I think that last piece, the checkbook plan comparison tool at healthplanratings.org, but you can also go and look at healthcare.gov. And I think a subsequent webinar that we will be having for small businesses is helping them decide when does it make sense to be counseling individuals to be going for individual insurance, or when does it make more sense to provide the insurance through the shop? What is the better deal for employees and for businesses alike? So that, be looking out for that opportunity going forward. Any other comments, panelists?
Yeah, for not-for-profits, there is a section on healthcare.gov for not-for-profits, and just like for small businesses, that the criteria for small businesses have to meet to get a tax credit, there are similar criteria that not-for-profits need to make too, and that lists all those criteria, and then there is a form that you can send in to the IRS and end up seeing your eligibility and calculating what type of rebate that you will end up getting.
I'll make one last comment on that too. I recently encountered a nonprofit who had approximately 25 employees, and they had historically not provided group health insurance coverage, but were really excited to see, kind of with the implementation of the Affordable Care Act, what some of kind of the new resources were available to them. But they were really kind of struggling with this exact issue of trying to really determine, did it make the most sense? Did they have enough of a budget to be able to play with, and would they qualify for a tax credit to make providing a group health insurance plan affordable for their employees who were not, did not have very high wages? Or if they, those same employees would be better off applying for tax credits on their own. And we really kind of spent a lot of pre-planning time kind of walking through different scenarios, looking at quotes, kind of taking some general can look at what each employee would qualify for if they were put through as individuals, and ultimately the group did not qualify for a premium tax credit based on their, ultimately their size. They were able to, kind of when everything was all said and done, they were able to kind of take a look at their budget, and they were able to create a program that most employees wound up choosing to participate in. But it really hinged on the fact that they did have some budget dollars to work with to be able to offset that for their employees. Had they gotten the tax credit, those budget dollars certainly would have gone a little bit further. But it was definitely some kind of sleeves rolled up, elbow grease at the table, number crunching that had to happen before it really came to a clear decision of what the right answer was. And the main thing that I took away from that experience was that that process has to happen for each employer. There's no sort of silver bullet that helps you decide what is exactly the right answer, because the right answer is different for each employer. So I just really encourage every employer to kind of hash through their situation individually, explore the resources that we've talked about today, and kind of leverage the help that is available, either from the navigator community, the certified brokers that are out there, to help really make those best decisions for yourself and your employees.
Great. Thank you, Michelle. Well, I would like to thank all of our panelists, Mary Timmel from the Small Business Majority, Michelle Thornton, who is working with HDA as our project director for the Small Business Initiative, and Jim Duffett, the executive director of the Illinois Campaign for Better Healthcare and the Small Business Healthcare Consortium. Thank you very much. Thank you all for participating. And once again, the recording will be posted on illinoishealthmatters.org. And we look forward to participating in another webinar with you shortly. And thank you for all of your comments. Have a great day.